Inject Derma Rolling is a non-invasive clinical treatment that uses microscopic needles to treat a variety of concerns, including pigmentation, scarring, aging, congestion, and stretch marks. Tiny puncture channels are created in the epidermis and dermis to encourage an organic renewal and regeneration of the skin through the skin's natural wound healing process. Some of the benefits you will see are visible skin rejuvenation, softer and smoother feeling skin, and a reduced appearance of aging, uneven pigmentation, scarring, stretch marks, enlarged pores, breakouts, and capillaries. Just a few points to note. This demo video doesn't substitute the need to come to training. This 15-minute demo only scratches the surface of what we cover in a full day's worth of training. However, it is a great tool for you to refer to and to be able to refresh knowledge. Health and safety guidelines also differ from state to state and also local council to local council. So make sure you check with your local council to find out which regulations apply to you. Darker skins and/or skins which are prone to post-inflammatory hyperpigmentation should also be prepped with even blend serum. You should also consider dropping your needle length and using a lighter pressure. The more aggressive the treatment, the more chance of post-inflammatory hyperpigmentation. A consultation is imperative to ensure client suitability for the treatment, and some skins will require strengthening first with product before they are ready for a derma rolling treatment. Contraindications can include poor skin health, poor wound healing, and heavy smokers, as fragile capillaries and skin petechiae can be excessive. Further contraindications are discussed in more detail during the full day class. In preparation for the treatment, a topical local anesthetic or TLA is applied to the skin. This will take the edge off any discomfort during the treatment but will not provide a sensation of total numbness. Ensure you read the instructions supplied by the manufacturer, as each topical anesthetic will differ in application and process time. The stronger the TLA, the smaller the amount that should be used. Be careful not to overuse TLA. As a guideline, use no bigger surface area than 3 hands, but always check with the manufacturer to ensure maximum safety, as the stronger prescription creams may only be used in very small areas. The application for the TLA we are using today is fairly simple and should take around 20 minutes to process on the face. Start by cleansing the skin with gentle cleanser and cool water. You may want to double cleanse if your client is wearing a lot of makeup. Remove with cool water and fibrella. Dry the skin with a tissue. Apply a large pea-size amount of anesthetic cream and massage into the face until it disappears. This should take no longer than a few minutes. Once worked into the skin, check the clock and start timing your 20 minutes of processing time from now. A second application is required and is left sitting on the skin as a light film or layer. During this processing time, you may need to attend to other things, and you will also need time to unpack your sterile dressing pack. Unwrap your sterile dressing pack. Remove contents and dispose of any items that you won't be using. Dispense your chlorhexidine solution into the tray. Then dispense your saline solution into the other side of the tray. Decant some Rejuvenate 15 into your tray so you're not handling products throughout the treatment. And finally, unpack your roller in front of the client so that she knows that she's getting a new roller. After 20 minutes, or as per manufacturer's instructions, you're now ready to remove any excess numbing cream from the face with some non-sterile dry gauze. Avoid asking your client at this stage, do you feel numb? Everybody's idea of numb is completely different, and you don't want your client expecting to feel numb like a dental block. Instead, ask your client, how are your lips feeling? Usually lips will feel a little bit big, can be a little bit tingly, or just feel a little bit strange. This is a really good indication that your anesthetic cream has taken effect. Anesthetic cream can sometimes cause different responses in the skin. Some people might go a little bit pale, some a little bit red and blotchy, and the skin can sometimes take on a little bit of a rubbery appearance. All of this is completely normal. Remove any excess or remaining anesthetic cream with non-sterile dry gauze. At this point, change your gloves over to sterile surgical gloves, or if you do not have these available in clinic, rinse your standard gloves in chlorhexidine. Prepare the skin by wiping over it with chlorhexidine using your sterile cotton pads from your dressing pack. You are now ready to roll the skin. Roller length is always chosen by assessing the thickness of the skin. A thicker skin will be able to tolerate a longer roller, and you will need to drop your roller length for a finer skin. You will need to break the face up into manageable sections and work in a pattern so you know where you've been. I like to work in a snake-like pattern similar to this, so I can see where I have already treated. Start with the forehead. Work in a simple back and forth motion and then move on. Back and forth, move on. Keep your movements small, no bigger than a 50-cent piece. The bigger the movements, the less control you have and the more risk of grazing the skin as it becomes harder to contour the face. When you see blood, we recommend you saline off as you don't want any platelets drying in the microchannels of the skin. Work the cheek area. Always reposition the client's head so that the roller is flush with her face and you are not trying to roll on an angle. This could potentially cause grazing in the skin. The cheek is a fleshy area, so you will need to really support and stretch the skin, and you may need to use a little more pressure in this area. Compress or apply pressure to any areas that continue to bleed. Work the chin area using the same techniques. Roll gently over the top lip in a sideways motion, avoiding the actual lip. Be careful as this can be quite a tender area. And finally, down and up the bridge of the nose and either side. So now you've treated the whole face. At this point, evaluate the skin's response. How does it look? You won't always need to go in to do a second pass. If it's really responsive, you may want to leave it. Keep in mind that everyone will have a different response. If it's just a little pink, then absolutely go for it. Or perhaps she hasn't responded as much as you anticipated, then go in for another pass. The second pass is always done in the opposite direction, still in your back and forth motions. If your client was quite responsive all over but just had a few areas of gaps, you could potentially use your second pass to fill in these gaps. Remember to keep using your saline and sterile cotton pads to cleanse away any blood. After your second pass, saline off the skin and reevaluate. The bonus with this device is you are able to stamp. Stamping is a technique used to create a small controlled wound in the skin and can be used to treat particular areas of concern. If the client is concerned with areas of pitted scarring, congestion, pigmentation, or lines and wrinkles, we can use the roller to stamp these areas. Ensure your roller is locked into place and with a little pressure, push the roller into the skin. Do this 4 to 5 times, changing position in an asterisk pattern. Keep in mind that not every client will require stamping. After each stamp, ensure you saline off. As we have created microchannels in the skin, anything you put on post-clinical treatment will have an intensified product penetration, absorption, and efficacy, so keep this in mind when deciding what to apply after the treatment. The two products which we recommend are your Rejuvenate 15 and your Multi-Active Mist. I'm just going to apply some Rejuvenate 15, Megan, to your skin. This is to aid with healing and cell regeneration. It's also like a big bowl of fruit and vegetables for your skin, I like to call it. Dispose of your roller in your sharps bin. Any materials that have come into contact with blood, such as your gauze or cotton balls, will need to be disposed of in a separate clinical waste bin. I'm going to finish off your treatment today, Megan, with an application of our hydrating mist. It's going to stimulate and revitalize those epidermal cells. Plus, you can also spritz it on at any time during the day to soothe, refresh, and hydrate your skin. Always follow the recommended aftercare guidelines with caution. For the first 12 hours, we recommend Rejuvenate 15 and Multi-Active Mist. The client must also avoid any activities which could have a negative effect on her treatment, such as hot water, exercise, spray tans, chlorine, and saunas for 48 hours. And lastly, the client must cease all active products for the next 3 days. For more in-depth knowledge of this procedure, protocols, and precautions, we really do recommend that you attend our full-day training course. Bye for now.